members tell us that all the time. Just like, I'm so glad I have, one person that I can talk to. That comfort and knowing that it's a small team and that, they're gonna get taken care of is very meaningful to the members.
Another member that every time she reaches out, I'm just like, I just want to reach through the phone and give you a big hug, because I feel like every time you turn around, you have to figure something else out.
We were talking about a team is what is our differentiator versus, a Google or somebody who could come in and try to replicate what we do. The answer from that is we care. We care about our members. Hey, everybody. Welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health. We get the joy of hosting thought leaders who are reimagining how healthcare is delivered. We're excited to have on the podcast today a couple folks who are a little bit different than what we've had on the pod in the past. Jasmine Fashola and Kelly Foster are two care advocates at CrowdHealth who help members navigate paying in cash. They help and are allies in navigating the complexities of the healthcare system. So we're excited to ask them how they do that today. Jasmine and Kelly, welcome to the podcast.
Thank you for having us.
I know that you've been listening to my previous podcast, so I'm thankful for that. You're two of the 50 that have listened to them. No, just kidding. No, but I wanted to have you all on because, one, you're just such an important part of CrowdHealth. But as I said before we start, you all know probably better than almost anybody on the planet why paying in cash is a great thing. You also know some of the hard things about paying in cash. And so I'd love to just have an open and honest conversation around, what is it like navigating this complex health system while paying in cash. As you guys know, you've heard this story probably too many times, but I started CrowdHealth because, I had an insurance plan who decided that my daughter's hole in her ear wasn't medically necessary and didn't need or didn't need a procedure. And therefore I had to pay $8,000 to pay for that. And so that's why I was like, this paying in cash thing should work. And as I started the company, one of the things that I really disliked about health insurance is every time you called into United Healthcare, you'd get a different person that you'd have to explain your healthcare event to. And then they would punch you to somebody else that you'd have to explain your health event to. And you would just get nothing done. and so one of the things I wanted to do when I started CrowdHealth was like, man, I want my team to be there for me, advocating on my behalf. And that's why we have our care advocate team. So the two of you are a team, so that when your members who reach out to you will talk to, most of the time, unless there's a complex condition or something, we'll talk to one of the two of you. How has it been getting to know our members, oftentimes on a very personal basis?
I would say it's rewarding. From that first phone call orientation, that's usually our first communication with the members. And, you think it's going to be a simple 15-minute call or less. And sometimes it just overflows and you learn so much about the members, their history, their kids, their families, and you just kind of get into this long conversation. But I feel like that personalized touch is what keeps our members here at CrowdHealth.
Yeah, I mean, for sure. Getting to know the members is definitely my favorite part. And I mean, I've had all kinds of, pictures of babies and pictures of baby cows and, a lot of really great things. And I like to talk to people. And so it works really well for me. I do tend to maybe go outside of that 15 minutes more often than I should, but I do feel like I have a connection with a lot of our members. And when they do reach out and say, hey, Kelly, this is what's going on, I know what they're talking about, or I know about their kids that are, experiencing these things, or, the questions that they know are coming. So it's good. It feels good.
That's great. And it's got to be helpful to the end user to know you. You get to know them, they get to know you.
Yeah.
I mean, you have a couple thousand families that you have to get to know between the two of you. They get to know you as one person. And so that's kind of cool. And so I imagine when they do call in, there's just a sense of comfort with, getting to know the person from their, trusted healthcare company. Especially with some of the things that are like, you guys walk through some hard stuff with our members. So the comfort there has got to be, just a nice addition to a healthcare industry that just seems so cold and impersonal.
Absolutely. Absolutely. And members tell us that all the time. Just like, I'm so glad I have, one person that I can talk to. And even if it's, I'm not available or Kelly's not available and we have to switch off, like it's still that comfort and knowing that it's a small team and that, they're going to get taken care of. It's very meaningful to the members.
So when you talk to the members, what are some of the concerns that they have about paying in cash? I mean, this is so different than health insurance. Do you hear concerns about paying cash from our members? And if so, what kind of concerns do they have?
I would say like, they ask, are there really doctors that only accept cash pay patients? And what do I do if they say, they like to say, what if they don't accept CrowdHealth? And it's always fun to tell them, well, you just tell them that you're, a cash pay patient, or they worry when they go to the hospital and they get those large bills, like, what do I do as a cash pay patient with, a $10,000 bill, and just being able to tell them, hey, once you get that bill, send it to us. We'll, help you negotiate that bill, and be able to just walk them through that.
Mm-hmm.
And I think people forget too that maybe not so much in office visits, but with insurance, you get a bill sometimes, especially if there's a deductible involved. It just takes a little bit of time. And then it's this paper and, it's kind of like, okay, what do I do? I'll make payments. This is a much more, we start on things a lot faster. And so sometimes those bills can look bigger at first and, we go in and negotiate them. And, but at the end of the day, when it's all said and done, you've paid your $500 member commitment, and then you've had this great community that's been behind you. Whereas if you have standard health insurance and, you have a $2,500 deductible plus, 80/20 or whatever it is that you've got, or things that aren't going to get covered for whatever reason. And then all of a sudden you've got this paper that's dragging with you over the next however many years if you're making payments. It's the initial, I have to pay this and then I get it back, can be scary. I do feel like there are some members that are like, wait, how am I going to pay, $1,000 right now? And, but just like you would with standard insurance, we can do, you can set up payment. We're here to help guide you through that, and figure that out too. So.
Yeah. That guiding you through it is maybe the most important aspect of what you all do. I mean, right. You guide them through something that, man, even with insurance, is just super complex. You can throw down your insurance card and not want to worry about it, but you're going to have to worry about it later. And so, for CrowdHealth, it's like, okay, well, it may take a little bit more effort, but in return for that, we think you get better care for a lower price. And so what would you want? Would you want a better care at a lower price, or just delaying the complexities and the heartache of dealing with this bill later, right? And And you guys are just such an important, part of that. One of the things people, when I talk to them, family members, friends, random people on an airplane who want to know what I do, they're like, man, how do you do this? Like, how do you know when to, call or not call, or what do we know what is covered, because that's the only word that they understand, covered and not covered, or what would a, crowd fund and not fund? It sounds so scary. And one of the things I tell people is like, just pick up the phone and call us, right? Or send us a text or send us an email. I mean, are there ever times when you're like, don't, I can't, this is a leading question. I can't imagine there's a time where people will reach out to you and are like, oh man, like this is silly. You shouldn't have reached out to me for this. Like, it's always good to reach out to you, right? Like, when in doubt, reach out.
Yeah, exactly.
I just made that up. I think we're going to use that in marketing. When in doubt, reach out. So what are people reaching out to you on a day-to-day basis? Like, what are the most kind of asked about things? Like, how do I do X? What would that be?
I would say like your routine labs and routine like colonoscopies, mammograms, those are
Mhm.
like daily. And simple enough, we just need you to like if your doctor, orders labs at your annual physical, don't go down the hall and get those labs done.
Mhm.
Send us the bill. I mean, send us the order, and then we can have a voucher created for you and saving you tons of money. I know, like specifically, there were a couple weeks ago, a member had, a $1,500 lab bill, and she just went down the hall and got them. And so I took the time to just go and see how much it would have been with the voucher. And it was like 500 bucks and
Mhm.
some change. It's like, always send us that voucher. I mean, send us that order. We can get that voucher created for you. Colonoscopies, we can often get those bundled, to include the facility, the physician fee, and pathology, because if you don't, you will receive those three different bills in the mail, and those can add up quite pricey, especially for that pathology. Um, so yeah, just those
Yeah,
are some of the things that I see daily.
that's great. I mean, I have my labs, even as CEO of Crowd Health, I was like, you know what? I'm just going to go across the street and do it because I don't, is it going to take too long? What do I do? And so I priced it across the street, and I think it was like $495 or something. And so then I sent it to you, Jasmine, directly. And within, I don't know, a couple hours, it was super quick. You came back to me with, a voucher, and I got it at the local LabCorp, which I think is like 2 miles from my house or something. And it was $45. And I'm like, oh my goodness. Like, I could have just spent $495 or whatever it was of other people's money, or, I can go and just do it at $45. Like, and it was not that difficult to do. That was super easy. On the colonoscopy, what we're seeing is colonoscopies are somewhere between $1,000 and $2,000, depending upon where you live. Health insurance plans are paying somewhere between $3,000 and $5,000. So people oftentimes ask me, "This is too good to be true," and my response is your health insurance plan is paying way too much for these services when you can get them at a much, much lower price if you pay in cash, and let us help you. And it's not a burden. I kind of asked you the leading question because it's not a burden on you all to help. It's actually, as you can see it in the smiles, like it's fulfilling to be able to help a member find a really great, doc or procedure at a really low cost. Kelly, your thoughts. What are the things that you're seeing on a daily basis that members call into you to talk about?
I mean, definitely labs, of course, and
Mhm.
imaging. I also get a lot of questions about, wellness visits.
Mhm.
How do I go about a wellness visit, or if I'm going to the doctor, do you negotiate the cost of the office visits for me? And, just walking them through the whole process, the going in, asking for your cash discount, also taking into consideration, does this provider offer a cash discount? How do they feel about cash payers? If you're going into an office and they're like, no, we don't have a cash discount, what are you talking about? That kind of thing. Chances are they may not be super flexible when it comes to, procedures down the road. But I also try to remind our members that, when it comes to your office visits, especially your wellness visits, for me personally, I want to be with a doctor that makes you feel good, preferably cash friendly and with a great cash discount, but I think that's so important. And so helping members understand that they can have both is really kind of cool and fun. And then when it's all done, they're like, this is great, so navigating those visits, those, office visits we get that a lot.
I love that. I was at a cardiologist, I don't know, 6 months ago, something like that. And I can't remember if it was you, Kelly, or Sharon, gave me a cardiologist in town who was cash pay friendly. And I went to the cardiologist and I checked out and he said, one, your cash pay discount is 60%. So I was like, whoa, that's awesome. And then the second thing he said is like, look, I know that you have to do some imaging after this. Typically, I would have you come back in to the office so that we can go over your imaging. But since you're a cash pay, can I just call you? It'll make it easier on you and me. I'm like, yeah, you can just call me. Like the last thing I want to do is come back into an office and, just to hear what the lab results are or the imaging results. And so I think, and you guys can tell me if I'm wrong on this, please push back. I think most of the doctors, and I haven't heard anything contrary, love the fact that people come in and pay in cash. Like this is not a burden on them. It is a like, hey, yeah, come pay in cash. We love that because we don't have to bill health insurance. We don't have to bill Medicare. We don't have to bill these, crazy big organizations. And, we can get cash. That's great for us. Have you heard, I mean, and honestly, I think there are parts of the country that might be a little bit harder, but have you heard people have issues with doctors accepting cash? And is it a lot of times or is it a little bit of times? Like what is the just kind of proportion, generally?
Yeah. We'd, yes, but it's very, very few. We did have a member who was pregnant, and we had a very, very hard time in finding a cash pay friendly provider in her area. And it was just because the provider she was looking at, I guess they've been burned in the past with people, saying that they're cash pay and then they later transitioned to like Medicaid. And so they just were unfortunately not cash pay friendly. But I can say, I think since I've been working here, I may have only encountered maybe like 2 times a member have said, hey, this provider is not cash pay friendly, and just helping them navigate to somewhere else.
So you've been in CrowdHealth for a couple years?
I made the 1-year mark in July.
So a year and a few months.
Okay, months,
so
yeah.
A year and a few months, thousands of customers, and you've had 2. Okay.
Yeah,
Kelly, what are your thoughts?
So I actually had a personal experience with a provider that didn't want to work with our cash services. And it was, of course, I thought it was kind of hilarious, but I see it from a different place. I basically was like, I'm going to go somewhere else and I know what's going on. But it is always a surprise. I think that, logically it makes sense, right? Like I'm going to pay you today. Why would I send this to an insurance company, wait, and then maybe get paid the full price? I think that some providers, I think it's so common for people to feel stuck in this idea of standard insurance, and that includes providers as well sometimes. Now, yes, there are certain states where I've called offices and they're like, what are you talking about? You have to have insurance. And so that's tricky to sometimes navigate that. But but for the most part, yes, doctors are excited. We get a lot of doctors that actually call in and they're like, this is great. I want to be part of your program. And so that's exciting too.
Yeah, a couple things on this. When people sign up, we ask them their profession. And so doctors and nurses, I think maybe healthcare professionals. Healthcare professionals is the number 2 most widely answered in that question. And so we get a lot of health professionals who are actual members of CrowdHealth. And some of our most fun members are doctors who are like, this system is so messed up that I have to transition to something else. I hate health insurance so much that I have to go and do something else. And then, I do think the one situation I've heard where it has been harder to pay in cash is Massachusetts. And for some reason, Massachusetts, they've got some weird healthcare laws over there. It's just been hard to find some, good cash pay doctors in Massachusetts from what I've heard. But the cool story about that, and again, I don't remember, Kelly, if it was you or Sharon, we had a member in Massachusetts who was having a hard time finding a doc. I can't remember what kind of doc it was. Maybe it was primary care. And we asked a bunch of other members in Massachusetts who are in the same area. Jasmine, was this you that walked through this with them?
It was Sharon.
Sharon, okay.
But I know what you're talking about.
Yeah. And so we asked a bunch of other members in Massachusetts if they knew of anybody good, and they were like, "Oh yeah, we know somebody great," and they were able to share their personal doc with one of our other members who apparently had a great experience. Which I think is cool about this community, where we can kind of step up and help each other, not only when we have a big health bill, but like finding a great doc. I know one of the things that we do now on occasion, if not always, is if one of our members asks for a doc in a specific area and we have other members in that area, we'll ask that member if they know of a great doc. So for example, Sharon reached out to me. Sharon is somebody internally who helps the care advocacy team find great docs, helps me also. She reached out and said, "Hey, do you know of any pediatricians in Austin?" And she actually gave my zip code, which is 78746. And I was like, "Oh yeah, I know a pediatrician. My kids go to this pediatrician, and this is the one you want to go to. And this is they've got a great bedside manner." And so for me, people not in the CrowdHealth community might look at that and say, "Oh, well, that's kind of a burden." But in reality, like if I can share something with somebody else to help them, whether it be money for a big health event or a referral to a great doctor, like that altruism feels good. It just feels good to be able to help somebody else with something in need, especially when it comes to healthcare related stuff. There's just something different about helping others with their healthcare that feels great. What are there stories that stick out in your minds that are like, man, I love it when our community helped this person? Or is there other stories that you can remember that are some of your favorites that you'd share with folks?
Ooh, so many. Um, I so we walk members through, hard stuff as well as, more, joyous occasions like giving birth. I know
A lot of
one
babies
particular
in Crowd
member,
Health.
all the babies.
Yeah.
One particular member, she actually had a miscarriage, and we sent her a care package, just to show that we were thinking about her. And then I know recently she actually just
Aw.
had a baby. So she has her rainbow baby. And it was just like, it felt good to be able to, navigate her, be with her, support her, during that tough time. But also now she has a beautiful baby. And when they send in those pictures of those babies in their Crowd Health onesies, it's so adorable.
We do send onesies to the newborns. It is a Crowd Health onesie. And if you had a baby with Crowd Health, and you have a picture with the baby with a onesie, send it our way. We want to post them. We want to put them up on on Insta and Facebook and stuff. So send us your pictures of babies. For some reason, obvious reason, when I put babies up on Instagram, like those are the most widely viewed, the most widely liked pictures that we put up on Instagram. Kelly, what do you have a favorite story or two of a member that you've walked through either good stuff or hard stuff with?
Yeah, I mean, I've had a couple that I don't want to say I've gotten close to, but I've worked with through
You can say that. You can say you've
events.
gotten close to it. I know your personality. You like to bond. It's okay.
Yeah, I really like it when I see their name. But yeah, we had a member. One of my first big experiences was with a member who needed to have a surgery, and she was in a more rural area, and we were trying to get her started. And anyway, we weren't able to, because of her distance from everything, we weren't able to find her what she was looking for. And I just dug. Jasmine has taught me so much about like looking for things outside of the box, I guess. And anyway, we found her a facility that she was able to go to for significantly less than what she was expecting. And also, it was way closer than what we were finding ahead of time. So she went in and she was already excited, but then this progressed into this major surgery for her. And the entire time we were in it together, and that was really nice. So when her daughter had an event come up quickly after her surgery and while she was still in recovery, she did not feel nervous. And, there were so many times in the beginning when this surgery was starting that she was like, I don't know if I trust this. And I literally would get on the phone with her and be like, this is what we're going to do. And it's going to be okay. And you know what? If it doesn't happen this way, then we'll see if it happens this way and we'll figure it out. And so she is a special member in my heart. But there's more than just one of those. I've got another member that every time she reaches out, I'm just like, I just want to like reach through the phone and give you a big hug, because I feel like every time you turn around, you have to figure something else out. And it's just, and so, I mean, there are a lot of stories. And like Jasmine mentioned, we go through so many experiences with so many people in any given day, and it changes so fast. And so I can be thinking, man, I could be friends with this member on Tuesday, and 2 weeks later, I've got a new best friend and a new member in a new state. You know what I mean? And so it's a lot, but I really, really, really love it. My favorite is when people come with me and they're like, oh my gosh, I'm going to get all these labs and they're going to cost me, $3,000. What is this? And I get to go in and be like, nah, we're going to get it to you for 500. And so it's like a game, and I love it. I'm so excited.
Well, what resonates with me after you guys have told your stories is, one of the things that I've hated about health insurance in the past when I've had it is that it feels like my health insurance plan is against me. Like they feel like my, almost like an enemy. I got to go to battle with my health insurance plan. How many times have you heard that? I have to battle with my health insurance plan to get my bill paid. And so what I think is really kind of beautiful about Crowd Health is we battle for you to get your bills paid, right? And so we are an ally, we're an advocate, we're a guide, and that's what you all do with our members. And you can tell, you care about these people and you want them to get really good care. And so I think, man, maybe, and I'll tell you the quick story. And I think you guys were on the phone when we were talking about this as a team. But we were talking about a team is what is our differentiator versus, a Google or somebody who could come in and try to replicate what we do, and I think the answer from that is we care, we care about our members, and we've changed our logo recently to a big orange heart, and we think it reflects just what we're about, which is we care about our customers. I'll even one step further. It's and some of these people I think we probably love, we love these people, as our kind of an extension of our family. One of the other stories that I had, which I think was crazy, and I don't remember, Margaret told me the story, and I don't know if they were talking to you, Kelly, or Jasmine, or somebody else, but we had a member who has and is currently going through colon cancer. And he reached out and he said, "Hey, I'm going through colon cancer and I want the best care possible. But I want you guys to walk alongside me, if you would, to help me get really good prices for these procedures. So I think his word was, screw the crowd." And so, the folks that we have know that they're members of a community. This is not CrowdHealth paying the bill. It's not some venture capitalist paying the bill. It's Kelly and Jasmine and Andy helping other people in our community pay the bill. It goes directly from me to you, or you to me. And so, that's a big differentiator between, what we're doing and health insurance, because if you have a big health event with health insurance, you think your health insurance is your enemy. And so it is a battle. You want to get as much from them as possible. With CrowdHealth, we are a part on your side of the battle, and your members, your community is on your side. And so you actually treat them like friends and not foes, right? And so I think that's a huge differentiator between what we do and what health insurance does. And I think that's what makes our model, really successful, is folks like you and others internally who love our members really, really well. I recently had a conversation with somebody, and they went to our Trustpilot reviews, and they're like, "I have looked at hundreds of companies, and I have never seen Trustpilot reviews like this. Usually it's like one sentence, they did a good job, but these people are writing paragraphs, and you two and others in our company are mentioned on multiple occasions. Like, thank God for Kelly, thank God for Jasmine, thank God for Sharon or Margaret or Andy or Andrea or whoever it is." And that's really cool to see that they, mention specific people who have cared for them well within the organization. What we're talking about here is, we talked a lot about CrowdHealth, but this is all within kind of this framework of like, how do you pay in cash? Can you do this, effectively? What would you all want our members, or people who are listening and are not members, but they're paying in cash, what would you want them to know? Like, what is one tip that you could give them if they, are paying in cash for their healthcare services, other than join CrowdHealth if they're not CrowdHealth members? Like, that's clearly, what you would tell them. But other than that, what is a tip that you could share with our members or people watching who are cash pay?
I would say if you receive a bill in the mail, before you just, haphazardly go online and pay that bill, call the number and ask for a cash pay discount. Many of times, especially like with lab bills or just office visits, people receive these bills and, they're like, "What can I do?" And I'm just like, they're so surprised when they call and say, "Hey, if I pay this bill now, how much will it cost me?" And they're shocked, like they actually get a discount. Otherwise, they would have just went online and paid the full price when they didn't have to.
Never pay the first bill is what we say.
Never pay the first bill.
Yeah, if I would have known, I guess it's almost 4 years ago now, when my daughter had that surgery and it was $8,000, I had to pay that $8,000 at the hospital. I didn't even ask for a discount, and they would have given it to me if I would have asked. So please, if you're out there, CrowdHealth member or not, don't pay that first bill. Ask for a discount. Most of the time, they'll give it to you. Especially if you can pay promptly. They will take it. That's an awesome one, Jasmine. Thank you. Kelly, what is did Jasmine steal it from you, or is there another good one that you another good tip that you could share?
No, so, number one, without a doubt, is Andy, when in doubt, reach out 100%, like reach out. It doesn't matter. I have members this week who have said, oh my gosh, you're probably getting annoyed by all my questions. No, 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 no. I love it. Ask me all the questions you want, because if you come back 5 days later and you're like, I have this huge bill and I got all this stuff going on. What are we going to do? And I'm going to say, we're going to fix it. We're going to figure it out. But inside I'm going, oh, if you would have just reached out and let me know, I would have told you not to do that, or, whatever. But that is a big one. I mean, I feel like that's number one, hands down, personally. But another one too is put a little savings aside for your healthcare.
Mm-hmm.
And don't be afraid to do it. I think we save for cars, we save for vacations, we save for all these things. And what we're doing here at CrowdHealth is so cool. And the end result is amazing. And it is sometimes feels too good to be true. And if you just have that little bit set aside to help you get started, to move towards crowdfunding, you're golden, and you can pretty much move through any of your bills, with just that little bit set aside. And it doesn't have to be thousands of dollars, it can be $700. I mean, I don't know, obviously everybody's situation is a little bit different, but don't be afraid to put aside a tiny bit. And you could do the difference of what you pay to your insurance versus what you're paying to CrowdHealth for 1 year. And you would, and then that also is just proof of the difference that we're actually making as far as, the bills for insurance versus the bills for CrowdHealth,
Yeah.
I don't know. That would be my advice.
That's really good. I love that. You know what? One of the things that we've talked about internally is, hundreds of thousands of families who have health insurance go bankrupt due to a health event every year. And it's because insurance plans either, deny their claim. I had to pay an $8,000 bill. Like that's a lot of money. And thank God I had to, because I started CrowdHealth as a result. I was so pissed off. But we have people who are going bankrupt, and I don't know anybody at CrowdHealth who's gone bankrupt because of a health bill. I mean, all of our health bills that we've submitted to the community have gotten funded. We're just asking you to pay the first 500. So if you should be able to come up with $500 somehow, and so I don't know anybody who's taken on medical debt because of CrowdHealth. And we have, I think it was like 70 million people in the United States have medical debt. And so that's awesome. Like the fact that we can actually help people, not just with their health care, getting them great doctors or getting them great procedures, but it's keeping them financially well, and additionally to physically well. And so that's a cool part of what we do also. One last question for both of you, and this is maybe a hard one, but why do you, one of the things that I say about CrowdHealth is I feel like we're a group of people on mission. This is important to us. So I say I want missionaries, not mercenaries, meaning people who are in it for the mission and not in it just to make a bunch of bucks. But we can, do that if we do well. But why do you do this? What is it that makes you drawn to helping people with their healthcare? What is it? Why do you come to work every day?
That is a good question. I honestly enjoy it. It's being able to help our members. I mean, the healthcare, industry is not easily navigated. You need a referral for this. You need, to jump through all these hoops, and just being able to just walk alongside members through whatever, life is throwing at them. It's so meaningful, because no day is the same. You never know what you're going to walk into. You walk in, I went to the ER for this, or you just like, oh my gosh, where I was just diagnosed with this. And and sometimes it is heavy. Like, you know, you go to bed thinking about these people and, you know, praying for their situations and things like that. But just being able to be a part of something different and a community that is, you know, um, full of people that are helping each other. You know where your money is going each month. You're helping someone else. It's not going into this, you know, big old pool as with insurance, but just being able to help our members each and every day through whatever it is, that's why you know, I'm with CrowdHealth and I enjoy my team. Like we work very well together. So yeah.
Love that. Kelly, what do you got?
I'm just going to keep rolling because it's everything that she said on top of.
You let her talk first, Kelly. So she's stealing all
I
your
know.
ideas
Great.
first.
No, she's good. I love it. You hit all the points and I, you know, ramble and she's got it. No, obviously, you know, absolutely. I love the members and I love the good, and the bad is not, I wouldn't describe it as I love it. The bad is powerful and meaningful and, you know, gives you purpose. And sometimes as moms and as people, you know, that purpose is kind of hard to find. And so it's great. But I also will say that I have to piggyback on the team because, and you kind of mentioned this too, Andy, but we're such a small group. And truly everyone, whether it's us, Jasmine and I talking to the members every day, or it's, you know, the development team, everybody is going in at with the same goal in mind and with the same idea. And so when I tell members, you know, listen, I'm here with you and I'm going to talk you through this. And I know that my director and my case manager and my, you know, everybody else behind the scenes is working for you. I can genuinely say that and believe it and feel it, and then know that everybody's going to show up for each other. And that's just, I mean, it's like a dream job, you know what I mean? And then, you know, you have a bad day and you call Jasmine and you're like, Jasmine, talk to me.
We have an awesome team. And the cool thing is you can text them. If you go on your app, you can text them. You can set up a time to talk. We don't do call centers. So if you want to talk to Jasmine or Kelly or any of the other care advocacy people, you can go on your app. You can schedule a time with them. That's way better than sitting on hold for 30 minutes with some huge call center in a different country. It's way better. You can email them and y'all get back to them, you know, quickly, especially for urgent situations. And so they're easy to get a hold of. If our members who are listening to this have Jasmine or Kelly as their care advocates, you now have faces. If you didn't do your onboarding call, shame on you. No, I'm just kidding. But if you, you see faces, which is always good. And so we're just thankful to you two for everything that you do. Thankful for your teams and everything that they do. You know, we're impacting thousands of people, you know, hopefully soon tens of thousands and hundreds of thousands of people using this model. And so you two have really proven that this can work, and you can be in healthcare and really have a caring, compassionate, empathetic, soul towards the people that you're caring for. So thank you for everything that you all do. Hopefully the people who've listened, whether you're a CrowdHealth member or not, know that there are people who will side with you and be your ally through the complexities of your health, the goods, the bads, both sides of that. We can be there to help you. So thank you both again for coming. I know that you were nervous being on the podcast, but you both did an awesome job, and I'm just so thankful for your willingness to do this. So I appreciate it.
Thank you.
Thank you, Andy.